Hi, my name is Cindy Gillis. This is my head-to-toe health assessment. Hi, my name is Cindy Gillis. This is my head-to-toe health assessment. I am doing the assessment on a 46-year-old male who is coming to my office for a well visit. He denies any pain or any concerns health-wise. He is simply coming for a well visit because he is new to our practice. Thank you. Come on in, Mike. How are you doing today?
Good, how are you?
Oh, good. Will you sit up here on my examination table? Watch your step. Very good, very good. Have you had any complaints lately with any health? Have you been feeling fine?
Yep.
Okay, good. I'm just going to check your vital signs, okay? All right. There we go. Thank you. Just relax. Excuse me. Okay, great. 140 over 67. It's a little low on the low number. Do you work out, Mike?
No.
Do you get any exercise, Mike?
Occasionally.
Okay. I'm going to take your temperature. Right under your tongue. Thank you. I'm just going to listen. I'm just going to listen to your heart rate right now real quick. Nice and regular. Would that be? Okay. All right, perfect. It's 98.1. Excellent. All right, Mike. I'm just checking his hair. His hair is nice and shiny, fairly evenly distributed with a little bit of thinning at the top, which is normal for a person of his age. Skin is nice and supple, moist. He has a little bit of redness in the cheeks and in the nose area. Can you open your mouth, please, and stick out your tongue? Great. Can you lift your tongue up? Okay, Mike, just close your eyes, please. I'm going to block one of your nares. I'm going to have you smell this object. Can you let me know what this is? Again, take a sniff. Are you able to identify that?
Vanilla.
That's correct. Very good. Okay, so Mike, I'd like to have you show me, I want you to open your eyes big and now close them very tight. And I'm not able to open those eyes. Great, I want you to clench your jaw. Very good. And he's very symmetric when he does this. The face is very symmetric. Are you able to puff your cheeks for me? Puff out your cheeks like so. And he's able to do that as well. Very good. Can you stop it? Okay, Mike, now I'm just going to do an examination on your eyes. Okay. I'm going to shine the light to the side and look for any scratches in the cornea. And I don't see anything. Great. And the color of his eyes are equal to each other. Now I'm going to check your pupils for reaction to light. Okay? So I'd like you to just look ahead. Great. good. Will you look at my finger, please? Excellent. Great, and his eyes converge in the middle evenly and symmetrically. Will you follow my finger? I'm going to switch fingers for you, Mike. Sorry about that. Will you follow my finger, please? And he's able to follow my finger and converge on it in the H form. Excellent, very good. Mike, now will you hold your arms out to the side? Excellent. And just touch one finger to your nose, and then do the same again. And then do that a few repetitions. Very good. So his hand-eye coordination is very good, and he's able to touch his nose with his hands. Mike, I'm going to hold this paper about 14 inches away from your face. Are you able to read this line right here?
Yes.
Okay, go ahead and do so.
Dear Hannah.
Great, great. His near distance is wonderful. And perfect. I see.
Stop.
Okay, now we know that Mike's eyes, his pupils are round, equal, and reactive to light, accommodation, and constriction. We're going to do a test on his peripheral vision. All right, Mike, I'd like you to tell me when you see my fingers in your periphery.
Right there.
Okay, great.
Mm-hmm.
Okay, thank you.
Mm-hmm.
Okay, excellent. Excellent. So his peripheral vision is intact on both eyes. And now I'm just going to check his lacrimal ducts for any kind of drainage by gently pressing. And they are dry and clean. His eyelashes are clean and free of any debris that would alert me to any kind of an infection that he may have in his eye. Stop. Okay, and I'm noting with Mike that his auricle of his ear is even with the outer corner of his eye bilaterally, and that his ears are approximately 6 centimeters in length, which is normal. Mike, do you have any tenderness if I press here?
No.
And how about behind?
Nope.
And then if I just gently pull?
Nope.
And he's free of any tenderness with manipulation of either ear. Then we're going to come around and use our light to look inside of the ear. And I see that the tympanic membrane is nice and pearly gray, and the inner canal of the ear looks nice and pink. Coming around to the other side, we do the same. And I find the same findings. His ears look great. Now we're going to do a hearing test. It's called the whisper test. Mike, I just want you to cover one of your ears, and I want you to repeat what I say. Okay, Mike, now we're going to examine your mouth. As we've already noted, his lips and his oral mucosa are nice and moist. Will you open your mouth, please? And when I look at it, his upper palate is nice and symmetrical. I don't note any discoloration or lesions. Lift your tongue up, please. Perfect. And the same here. I don't note any discoloration or lesions. Stick your tongue out for me. Great. And say ah. Can you just tilt your head down a little bit? Great. And I see his uvula in there. It is midline. And I don't see any swelling or redness. Everything looks nice and pink. Thank you very much. You can stop it. Now listen to your lung sounds. Just give me a nice deep breath with your mouth open, please. Again. And Mike's lung sounds are clear throughout. You can stop it. Now I'm just looking at his legs for color and warmth. He has hair equally distributed on his lower extremities, including all the way down to his toes. So that means we have some good venous blood flow here. We're going to palpate pulses. And I have a +2 popliteal pulse here. And again here. I have +2 Achilles pulse. Bilaterally. And +2 femoral pulse bilaterally. Are you able to wiggle all of your toes? Great. And how about your ankles? Can you take your feet and push up against my hands? Your toes up against my hands? Very good. And down. Very good. Are you able to take those feet and point them out to the side? And then point them in? Very good. And then point them up towards your body. Flex them, that is. Great. And now down. Try to touch my hands. Very good. He has good range of motion in his feet and good strength. +5 for strength. Okay. And now we're going to move on to his knees. Can you take and bend your knee right up? Good. All right. Can you take this knee and bend it? Take this leg and bend it out to the side. Very good. And now in, across. Very good. And now take this leg and extend it up in the air. Great. All the way up. Excellent. And that shows that his hip is good here. And now out. Now take and put your entire leg straight out toward me. Very good. And now back in. Great. And now across your body this way. Excellent. Okay. And he has good range of motion in his left hip and his left knee. And take this right knee and bend that leg to a 90-degree angle. Very nice. Take that leg and straighten it up, right up to the ceiling, if you will. That's very good. Excellent. Take that leg now and put it down to the side. That's okay. We'll do the knee. Go ahead and put your hip down to the side. That's great. And now we'll do the internal rotation for that hip. There you go. Very nice. And then we'll straighten out this leg and bring your leg right out to the side. Very nice. And bring it back in and back over here. Very nice. Okay, you can put it down. Great. Now take that leg and press up right up against my hand. Excellent. And now down. Excellent. And do the same. Very good. And the same. Very good. And now I want you to take those legs and press them against my hands on the side. Oh, very good. Yep. Press them right against my hips. So he has good strength going in. And now out. Press against my hands. Very good. So he has +5 strength in his entire lower extremities. Excellent. Will you sit up for me? Oh. All right. Now, I want you to sit up straight. Take this arm. Take both of your arms and put them out straight. That's excellent. Now take them out. Excellent. Are you able to do this and the same? Very good. And bring them forward. I'd like to see you go put them up. Excellent. And then down. Very nice. Then I'd like to see you go across your body like so. And the same on the other side. Very good. Now it's very convenient. And now hop right on down off of the table. Excellent, excellent. Here. Okay, so I'd like to see you, actually, why don't you come over here so we get it in the camera. Sure, turn on around. All right, great. So walk towards me. So he walks upright and steady, erect. Now I'd like you to turn around and walk back. I examine his spine and I see it's nice and straight. And turn around. Now when you walk back towards me, I would like you to do a heel to toe walk, like so. And this checks for coordination and motor, and it looks like he does pretty well. He's straight, heel to toe, he doesn't lose his balance, and he has good coordination. That's excellent. You can stop. Now I'd like you to take your hands and put your hands at your side with your palms up. Excellent. Close your eyes and just stand there. Excellent. He has no deviation of his palm. Okay, now we would like you to put your arms down straight to your sides, right against your side, and stand straight and close your eyes. Okay, great. Stop it. So we know Mike is negative for palm or wrist, and that is good. So now we're going to check the range of motion of Mike's hands and wrists. So go ahead and hold your hands up for me, Mike. Are you able to take all of your fingers like so? Very nice. And go in with your wrist and out and around. Excellent. I'd like to do a test on you. I'd like you to stand with your hands like so, and I'm going to have you stand like that for a minute. I want you to let me know if you have any numbness in your fingers, and this is a test to rule out carpal tunnel. This is called the valence test. Do you have any tingling or numbness in your either hand? Okay, great. Excellent. All right. Okay, and while we're at it, hold your hands together for me, and I just want to look at your thumbs. Excellent. And Mike does have a small diamond in his nails, and therefore we know he doesn't have any clubbing. So that goes along, obviously, with respiratory, but so Mike has no clubbing in his fingernails, which would be indicative of dyspnea or hypoxia or a hypoxic state over a long period of time. Okay, you can stop it because I don't even know what. Now I'm going to check his lymph nodes. I'm just going to palpate lightly for his preauricular, which are non-palpable, and still non-palpable. And the tonsillar, look up just slightly. I cannot feel his tonsillar lymph nodes. And submandibular, I'm unable to palpate the submandibular lymph node. And the submental, I'm unable to palpate that. I'm going to come down. The anterior superficial. Now I'm just going to test my sensation on his limbs for sharp and dull. I have an object I'm going to show you. This is sharp and this is dull, okay? So I'm going to just ask you to close your eyes and just tell me what you feel. Okay, that's great.
Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. 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 Dull. Dull.
I'm going to do your legs too.
Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp. Sharp.
Okay, and he has good sensation in all of his extremities. Good stuff. sensation test. Mike, I'm going to put an object on your skin, and you're going to let me know when you feel that I have two separate points on your skin and not one, okay?
Two.
Okay, great.
I guess that's two.
Mm-hmm. Great. So he felt the two at about 3 millimeters on the bilateral finger. We're going to do it on the back as well.
Two.
And he felt two at about 2.5 centimeters on his back. And we'll do the same on this side.
Two.
And the same. At about 2 centimeters, he felt 2 points. So that's normal for you to have a different sensation. You're much more sensitive in your fingertips than you are on your back. Okay. Now we're going to do a stereotypness test. I want you to close your eyes, and I'm going to put a familiar object in your hand, and I just want you to let me know if you know what it is.
Quarter.
Yes, it is. Correct. Good. Very good. And we know that that sensation is intact. Okay, and if you put up your palm, you can close your eyes. I'm going to write a number on your hand, and we're going to see if you can tell what I'm writing. Okay.
3.
So his gravasthenia is intact as well. You can stop it. The deep cervical chain lymph nodes are non-palpable. And the subclavicular and the supraclavicular chains non-palpable. Now I'm going to inspect Mike's trachea. It is midline. Can you look up, please? Great, and swallow. Great, and I can feel that. It's a smooth movement. I don't note any deviation in that. Stop. Okay, Mike, now I'd like you to take your shoulders and push up against my hands. Shrug, very nice. His shoulder shrug is even with even strength, +5 bilaterally. Can you take your head and just turn it to the right? And then
That was the left.
And then to the left. And move it up. And move it down. And take your head and put your ear to your shoulder on one side. Great, and do the same on the other side. And now look straight up to the ceiling. Great, very good. And he has full range of motion to his neck. Very nice. Stop. Now I'm going to palpate his temporal and his carotid arteries for any bruits. And I don't feel any bruits here. And neither do I on either side bilaterally. And now I'm just going to oscillate. Okay, great.
No brewskis.
Okay. And now we're just gonna assess the respiratory system. Mike, can you just take a couple of nice breaths for me so I can examine? Great, and nice deep breath. Great. And obviously his breathing is nice and even, unlabored. Respiratory rate is normal at 16, and he's just a comfortable breather at this time with no problems. You haven't had any shortness of breath or anything of that nature, have you, Mike?
No.
Excellent. Okay, let me come around this way so that you can see. Okay, will you turn a little bit for me so I can see your back? Okay, great. So I'm going to use my hands. Will you sit up straight, please? And then I'm going to ask you to breathe in, and then I want you to let all of the air out. Very good. And do that again. Very nice. Okay. You can stop for a second. Now we're going to check for tactile fremitus. Mike, when you feel my hands press on you like this, I just want you to say 99, okay? Sit up straight. Good.
99. 99. 99. 99. 99. 99. And
as it should, tactile fremitus decreases from the apex to the base of the lungs bilaterally. Stop. Now we're going to do percussion. All right, Mike. I'm just going to percuss your lungs throughout. And his lungs have residence throughout. Very good. Now I'm going to measure your diaphragmatic excursion. So Mike, I want you to sit up straight, and I want you to take a nice deep breath in, and then I want you to let all of the air out of your lungs. So take a deep breath in and let it all out. Very good. Now hold it out. Very good. You can that's good. Now, Mike, I'd like you to take a nice deep breath in, and then I want you to hold it. So sit up straight. Very good. Okay. All right, so now we're going to do a quick cardiac assessment. I'm going to examine Michael for any lifting or heaving of his chest. I look at his cardiac areas. I look at his aortic, pulmonic, the Erb's point, tricuspid, and then his mitral area. And I don't see any lifting or heaving. Next I'm going to listen. Next I'm going to use my hands to feel for any pulsation while he is breathing and while he is laying here. And I feel in all of the areas. I don't know any bruit in any of the areas of the heart. Next I'm going to oscillate. First I'm going to use the side of my stethoscope, and I'm going to listen in the aortic, the pulmonic, Earth point, not true. I'm sorry. The tricuspid, and lastly, the mitral. And S1 is greater than S2 on the first three, and S2 is greater than S1 in the aortic. I mean in the mitral and the pulmonic. I'm sorry, in the tricuspid in the mitral area. Next, I'm going to use the bell of my stethoscope. And I'm finding the same finding, and I don't hear any bruits or thrills. Next, Mike, I'm going to have you lay over to your left side. Can you come over to this side to video? I'm going to have you come over onto your left side. I know it's kind of a hard surface, so just as much as you can. Perfect. Next, I'm going to have you sit up, Mike. Perfect. I'm going to have you lean forward just a little bit so I can listen from... Come around this side, so I can listen for any murmurs in your, mitral, and pulmonic areas. And I do not hear murmurs in these areas. Okay, stop. So while Mike lays on his left side, I'm going to listen for any bruits or thrills in his aortic and tricuspid areas. And doing the same in with my bell. And I don't hear any bruits or thrills in that area. All right, Mike, now I'm going to have you lay back down. Thank you. And I'm going to, you can come over here probably. And I'm going to examine my abdominal region for any scarring, to see if I can see any peristalsis, which I do not. It looks very normal. I don't see any odd bulges which would indicate a hernia. His umbilical area looks like it's free of any herniations. Next, I'm going to listen to his abdominal sounds. So I'm going to listen in the aortic area to see, make sure that I don't hear any bruits. I do not. I'm going to listen for bowel sounds in all quadrants. if vowel sounds are present in all 4 quadrants. Not hyper, not hypo. Next, I'm going to listen for any bruits in the iliac crest area. I do not hear any. And lastly, in the inguinal area. I do not hear any. Bilaterally. Next, I'm going to lightly palpate his abdomen in all four quads, looking for any guardian. Do you have any pain, Mike?
Nope.
Feeling for any masses or bulges? Being sure to check for any guarding or grimacing that might happen. And he appears to be free of any pain or have any masses. Next, I'm going to do some deeper palpation. And I don't notice any masses. Or any guarding. Next, I'm going to feel for my spleen. Or listen for his spleen, actually. Mike has good resonance throughout. I don't hear any dullness in his abdominal regions. Lastly, will you switch places with me so you can see me from the other side, right, Mike? I'm just going to feel for my quiver to make sure there's no enlargement. Will you take a deep breath in? Great, and now let it out. I don't feel, I am unable to palpate the liver